when a patient comes in with XYZ problem and you diagnose disease A, which could be let's call it a skin infection, and I hand them an antibiotic and an anti-inflammatory and a shampoo and this and that, and a bottle of omegas, and let's say they have absolute confidence in my recommendation and take everything and start using it, and the dog gets better. 2 months later, the dog comes back and it's kind of relapsing, getting worse. And we go over things like that. And what's happened generally is they've done all the antibiotics, they've done this, and they've done that, and they've kind of kept up with the bathing. They kind of backed off on the bathing because the bathing back-off program was twice a week to start out with, once a week for a while, every other week and the like, and they're actually backing off on the schedule that I proposed. But they've stopped the supplement. They've stopped the omegas. And the client says, "Oh, I stopped it." I said, "Well, why?" "Oh, I didn't think I was supposed to keep it up. I didn't think it was that important." And that's kind of that's why I'm losing all my hair. Is that I didn't communicate enough importance on that product. I think the flip side on the other end of the exam table is also happening. They think the penicillin or the antibiotic for the skin infection is really, really, really important, and they're really, really religious. Well, some clients aren't religious about anything. I shouldn't have said that. Not you guys. You guys are very religious about doing what you're supposed to. But some clients, give till gone, they don't see that at the bottom of the label. They don't think that's important. They give it until they feel like stopping. They run out of the omegas or whatsoever, and they stop, and all of a sudden the dog relapses. And it relapses because it still needs the omegas. The omegas are a really interesting phenomenon because the amount of omega acid and docosahexaenoic and isosapontoic acid that the patient produces is under genetic control. And if the patient needs this much and its genetic output is this much, if the patient needs this much and its genetic output is this much, got my levels mixed up here, forgive me, it's 100% happy. And it can be like that for absolutely forever. What happens if it gets a skin infection? And the skin infection requires more anti-inflammatory effect than this level is giving it, and its requirement now is up to here. Now its skin is never going to be the same as long as it needs more than it makes. It's like water in the bathtub. If the drain is too big, you're never going to fill it up, and you're never going to be able to take a bath. And the skin infection, the skin disease, the inflammation, not necessarily infection, but you can have allergy, and that what it does, it increases the stress, increases the need for more stuff, and you add it, and once you add the supplement to it, everything's now in balance and the patient can heal. Will that demand lower over time? Possibly. But the amount that the patient made in the beginning, way down here, will never change. It can never make more than its genetic control. That's why I was taught in school, is that the dog doesn't need any supplements. Well, the average dog can make enough for normal health. And that's what my profession was measuring decades and decades and decades ago. It made some, it didn't need any more. Well, we found out that during the inflammatory process, it needs this much, and it can only make this much, and it's not going to get better until you add that much. And that's why all those West Highland White Terriers that were just a disaster got better when we added above that kind of threshold. So my point is that a lot of patients, when they had that inflammatory disease, they probably had allergies, and the allergies were still going, and when they took that supplement away and it fell below the threshold of what the dog was making, it got worse. And my point is that I think myself, from time to time, and my profession in general, don't emphasize the importance of these supplements enough. We're brainwashed that penicillin's important, we got to do this and we got to do that. We now have to take extra CE, extra continuing education to make sure that we're using them properly. I think that's good, but that over prioritizes in Doc's brain that the antibiotics are important, and we got to talk about that. We got to do this, and maybe we need to culture about that. But the supplements which may be as important in the healing process, are getting second fiddle from the standpoint of priority. And if they fall off the scale and the patient gets worse, I think that does everybody a disservice.